I'll dive right into the agenda. Around 2 years ago, we had the IFC Healthcare Conference. We organized that in Istanbul. And at that point as well, we had an Africa Roundtable. I think Shakir was certainly a part of that, which also shows you who is aging and been around in the space for a while. But at that point, we spoke about the opportunity in the African healthcare market. We spoke about how it's a continent with 1 billion people. It's a continent with some of the fastest growing GDPs in the planet. It's a continent also with some of the least developed infrastructure in healthcare, and a confluence of all this resulting in an opportunity for operators, investors to enter and shape an industry in possibly the last remaining frontier growth markets in the planet. So that was the story then. Today, as we get together, it almost seems like an old story. It is the story of the opportunity of healthcare in Africa is today with fair degree of certainty. You can take it as an objective fact. So we won't be spending too much time discussing or trying to sell the Africa opportunity. We'll spend the time discussing how some incredible enterprises, entrepreneurs, multinational companies, investors are capturing that opportunity, how they are coming together, bringing their respective competencies, bringing their respective strengths to bear, and working together to capture that opportunity. And in order to discuss that, I think we have possibly the best possible panel one could assemble. Most of them don't require too much of an introduction. I'll start with the three gentlemen here because they're doing something together, and that's the whole spirit of this panel, this discussion that we want to have. How can we work together to capture on the Africa healthcare opportunity? Fareed is the CEO of GE Healthcare in Africa. GE is also the sponsor of this panel, and in many ways that is a pretty, it's more than the fact that they have come in and said, okay, we'll sponsor the panel. They, as an institution, have played a role in the trend that we are seeing in the continent, the excitement that is being generated in the healthcare space. A multinational which doesn't require much introductions, more than 100 years of history, with, I'm sure, many $1 billion invested in healthcare around the world. Last I read, you touched more than close to 1.5 billion lives. So one of those really respected global healthcare leaders, and Fareed within that organization is in many ways an epitome of what the organization represents in the healthcare space. Hugely respected and well-liked among all of us who work in the healthcare space. Really excited to have you, Fareed, as part of this panel, and looking forward to hearing more about some of the innovations that you folks are bringing in Africa, and also what you have done in other markets like India. Next to Fareed is Sanjeev. Sanjeev runs India's largest chain of diagnostics and pathology centers, about 1,500 odd collection centers, 200, 300 odd centers around the country, a part of the Fortis umbrella. And Sanjeev himself has several decades of experience in healthcare. And one of the interesting things is that he was part of the team which helped Fortis make its first international acquisition or expansion into an emerging market, which happened to be in Africa. So Sanjeev has been involved in the Africa story for a while, and with Fareed and Dr. Benson is trying to do something which I'll get into in a bit. Dr. Benson is an incredible entrepreneur, one of the rare breeds of doctor entrepreneurs. He set up what is today, I would think, Nigeria's largest chain of diagnostic clinics. He has 9 centers around 5 states. Am I right, Dr. Benson? and also an incredible clinician who has evolved into an entrepreneur. So the three of them together are working on something which, as I mentioned earlier, epitomizes what we are trying to discuss. Dr. Benson's enterprise, it's called Eagle Eye or EcoScan, has been invested into by IFC and GE, but in collaboration with Sanjeev's company, SRL. So together, we are bringing in the local knowledge, relevance, expertise, reputation of Dr. Benson with the global expertise, knowledge of a GE, of a SRL, of an IFC together to chase the big vision, which is to dominate diagnostic services in Nigeria in order to provide good quality, affordable services there. To Farid's right is Alex Alexander. Alex is part of, is the MD of CL Healthcare Africa. Again, a very interesting entity which brings together multiple actors. The sponsor, the core entity behind CL Healthcare is one of Mauritius' oldest business conglomerates called CL, with interest across multiple sectors. And when they expanded into the healthcare sector, they decided to do that in partnership with IFC and one of the world's largest healthcare operators based out of India, Fortis. I'll let Alex talk more about that. Alex himself has had an interesting journey from an analyst in Goldman Sachs to several decades, or rather around a decade or so. He's not that old in the healthcare space, growing with the Fortis network. Fortis today has about 7,000 beds, 7,000 people.
10,000 beds.
10,000 beds in India, and Alex was one of the first managers in that system. So he's seen and contributed to the growth of one of the largest emerging markets healthcare players. And finally, it's a cliche, but in the case of Shakir, certainly appropriate, last but certainly not the least by any means, a good personal friend and also that of IFC, Shakir Mirali. He's the managing director of Africa Health Fund, which is managed by Abraj, one of the largest emerging markets investors there is. Shakir brings in a unique combination of financial expertise. He went to the London School of Economics, a Kenyan African, very proudly so, if I may say that, but with a lot of international experience, which he brings to bear and combines with his expertise in healthcare, which he has garnered over the last 5-6 years. So this, ladies and gentlemen, is the panel. As I hinted, these are not individuals who are just there because they represent great enterprises or because of what they have done in the past. They are here because right now, as we speak, they're all working together in some form or fashion to define what will be the healthcare sector in Africa over the next few years. So I'll stop talking in a bit and pass on the baton to each one of you. Please spend just 5 minutes articulating very briefly, not what you're doing, that I think I have tried to do, but why you're doing what you're doing, and what is it that you're specifically doing in the context of working with, bringing people together, bringing expertise together to harness this opportunity in the healthcare space in Africa. So I'll start with Dr. Benson. As an entrepreneur, maybe you're the best person to kick the discussion off.
Thank you so much. Good afternoon, ladies and gentlemen. The introduction is done already, and it's been a journey of several years. But thank God we are having a session today where we are talking about what we are doing and why we are doing what we are doing. We recognize the need in the healthcare industry in Nigeria that diagnosis is a problem even among the public sector players. and equally so in the private setting several years back, in 1998 to be specific. And we decided to see how we can play in that space as clinicians. Therefore, we set up this diagnostic business called EchoScan with the general mindset of providing diagnostic capabilities to assist the clinicians to do their job more efficiently. Small business between myself and my late partner. But then, gradually we discovered that the need abound everywhere around the country. We started from the north, that's in Kaduna, in northern Nigeria. The passion always has been to provide these services, radiology and pathology services, laboratory offerings in our region. So in 1999, we opened our door to the public in Kaduna, and in 2002, we opened a branch in Abuja. In 2004, we migrated to the south, to Delta State, Asaba, and then Port Harcourt at the same time. Just with that singular passion to do the little we can, to provide diagnostic capabilities in those localities. We soon discovered, of course, that we can't do it alone. What we want to do is massive. We needed, funding, we needed money, we needed expertise, which simply we didn't have. Our growth was organic, leveraging on bank credit, savings, and all sorts of family support, as you can imagine. 2007, we opened a branch in Lagos, Okpebi, and we just continued, going that way. Around the same time, we had a private-public partnership with the Gariki Hospital in Abuja. Again, taking over the diagnostic services in that hospital, which is about a 250-bedded hospital, alongside with the NISA group. Like I said, we wanted to do more. The appetite was to do more. But we didn't have, the funding support, and we also didn't have all the know-how in terms of technical abilities to do it. So in 2010, we reached out the first time to the IFC, discussing with them the possibility of getting some funding into our business so that we can do more than what we were doing. At that time, I can say we had a different IFC that had a different mindset. They saw us as a very small company. Our book balance was not interesting to them. Our project was small. As at the time, we were looking for between $3 to $5 million, and we were told they couldn't do anything below $20 million. But to cut a long story short, in 2013, the mindset changed, and we had a different group from the IFC. We had Eric Sovega coming in from South Africa. We had Ken Osei coming in from Kenya, branches of the IFC. And locally, we had GE also coming in. We had met Farid, myself in the company of Dr. Austin Okogun, in 2010 in Johannesburg. 2012 now, in Johannesburg. So 2013, Ngumocho joined GE, and he was assigned to us to look at our project. And it was interesting that from that time, it became clear that there was a paradigm shift. The people who didn't want to associate with us before now because we were small are now ready to do business with us. And so we took the discussion, to the next level. Bottom line, we needed finance, and we also needed the operating capability to be able to do bigger things than what we were doing. And that brought us in contact with the SRL team that was introduced to us by the IFC. So the IFC was not only bringing finance to the project, but they were also playing the supportive role of pointing us, to groups that have done this elsewhere. And that's how we consummated the relationship with SRL. We traveled to India to see their operations. GE was equally very helpful, wanting us to look at the spectrum of operators here and there. We traveled to Athens to see Euromedics. Everybody was just excited to see how we can make this happen. So as against talking the talk, we are now walking the walk. And it's exciting to know that yesterday the press release for this project was actually made. On the table, I forgot to mention, in 2013, when the conceptualization of this project commenced, Abraj Capital was also represented in the person of Dr. Segun Osho. I mention these names because every one of them had passion to make this happen. It wasn't about the industry or the companies they represent, but the individual passion that we had in the room the day we had our inaugural meeting was quite palpable. The team became, let's do this for Africa. Let's do this for Nigeria. These are Africans wanting to do something different in Africa. And by God's grace, we are where we are today at the implementation phase of our project. I don't know if I've covered your question.
So I think you've done even better. I think you've given the story and added real depth to it. I think to one of the points that Dr. Benson mentioned with regards to IFC's interest in doing this as well, I think certainly we have come a long way. Just in the last 9 months or so, we have approved close to $50 million of investments in exclusively this kind of ventures, where we have brought entities together to chase investment opportunities in healthcare in Africa. So a good segue to Sanjeev quickly. And since Dr. Benson gave a real color about this whole EcoScan story, what I would love to hear from you is, why are you doing it? You have a pretty large market in India, about 1 billion and so people, pretty dynamic as well. Why are you partnering with Dr. Benson in Nigeria?
So thank you, and good afternoon, everybody. So in earlier days, talking about 3-4 decades back in India, love marriages were not very common. Marriages were arranged, and we had to go through a middleman known in the Indian language in Hindi as a pandit. Now, whenever I see IFC, they remind me of those pandits. Very astute, very tenacious, and know just what they're doing. So about 2 years back, when Eric and team, they approached us to partner, to be important partners in this deal, I was a little foxed. Why SRL and why Africa? I mean, we've got a large market sitting in India, as you just mentioned. Why should we be looking outside of India? Then I realized and contemplated, kept on thinking, and realized, well, we have a certain affinity with Africa. If you look at the history of India, we've got a lot of enterprising Gujaratis, which is a state. Gujarat is a state in the western part of India, or Punjabis, who have historically been visiting Africa on business. And there are many early settlers. You would have seen surnames like Patels, Shahs, Singhs, and you'll find some of those sitting in this room. So there's a certain affinity with Africa, and Africa was a natural choice for us in that sense. And I really see in sub-Saharan African countries what India used to be about 2-3 decades back in terms of the healthcare, provisioning of healthcare services is concerned. Countries, even India at that time, a little timid, a little skeptical, tentative, but raring to go. Loads and loads of hope, very young, and amazing skill set with the people, with the teams. And I thought this could be a possible good mix where we need to really, invest the time and resources and energies. Thirdly, I could resonate most of the countries what India used to be, again, 2-3 decades back, filled with poverty. I mean, below the poverty line, of course, it is shifted upwards some time back, but majority of the people, about 50% of the people were below the so-called poverty line about 4 decades back. very poor. And going by the increasing cost of healthcare delivery, I think it was very important for us to try to bridge this gap and make the healthcare or diagnostics available to the people who are quite like us, in a short span of time. Need of affordable healthcare was a need of the hour in the sub-Saharan African countries. Fast urbanization was something which was, again, very, very common. We see a lot of people in Nigeria, if we talk about Nigeria, from the surrounding areas, people are now shifting towards Lagos, to Abuja, Kaduna, and so on and so forth. Infectious diseases, and we have seen it all, malaria, dengue, and I think African countries are not too different. I mean, you talk about HIV/AIDS, which is rampant. Now I think it's being kind of controlled, but the incidence is still very high. You've got hepatitis B virus, hepatitis C virus, you've got malaria, you've got Ebola, and other such diseases. Now the pattern is changing towards the non-communicable diseases. So I think all in all, we thought this is a good mix. Now, this is at the macro level. At the micro level, what is it that we should be doing in Africa? See, we have been running this model for the last about 20 years in India, and quite successful. We are quite young in that sense. We have companies in India which are into diagnostic space, and they are about 5-6 decades old. Yet, what we could achieve in this short span of about 18, 19 years is by no means a small achievement. And I give the credit to the team members who are so committed. So it was all about people. I think running businesses, whether it's on the healthcare side or any other sector, I think it's all around people, all about people. The sense of commitment, which comes from the people, from the team that we could create, was really amazing. It was quite humbling experience, and I can share with you. A lot of people come to me and ask us that, why don't you just join hands with us to create something what you have created in India. I think two things which are very important to us. One is the value system. I think we have to have that kind of value system which we have. Second is, if you can really feel the pain of the patient, looking at the patient face, if you are able to get that pain, then you have the right to be in business. This business is not just like any other mundane stuff which you're doing. I used to run the hospitals before I took the reins of this diagnostics company, and let me just tell you, it was a draining experience running hospitals. When I joined Fortis, Alex is a witness to that, I used to acquire hospitals for Fortis, and I did a lot of acquisitions nationally and internationally. And then all of a sudden, it dawned upon me to get into operations, running the hospitals, which is a core business. And first 15 days, I lost my appetite. Believe me, I used to cry after looking at the patient's face. So it's not about just running the business. People who say that business has to be run in a practical manner, in a material manner, I disagree completely. Diagnostics, healthcare is the space where you have to be emotional. And that's where I felt that we can really contribute a lot. Given the scenario which is prevalent today in Africa, I think that is one of the things which I thought. And then, of course, there are multiple micro factors. We have a model which is replicable. We have got expertise in creating a network. Now, being the largest company in India is not a great feat. Let me just assure you on this. I mean, there are multiple companies, multinational companies doing much better job than we can do. But what is really important to me, and why I take pride in that, is the fact that we have been able to reach out to the masses. Gone are the days when people used to visit the hospitals or the diagnostic setups. Now's the time when the hospitals should be reaching out to the masses or to the public. And that's what we did. 270 labs in India with 6,000 collection points. We are quite close to the people. Now, some people ask, are you fools? Why are you really replicating these labs? Why are you putting so much of monies and investments into creating labs? I mean, one lab, there's a company which is having one lab, and they're trying to cater to as many people as possible around the nook and corner of the country. But my question is, if we are replicating this investment, I think it is for the future, for the good of the people. I'll be very skeptical of sending a sample to a center where the sample has to travel for 500 miles to go to the lab where it is to be tested. The integrity of the sample will be a big question mark. So idea was to be closer to the patients, closer to the masses, and do as many tests. About 80% of tests are being conducted by us locally. So which means that today, out of about 500, 600 cities and towns that we are present in India, we are at ground zero, present very, very locally. And that's something which we're really proud of. IT prowess. I think we have been able to create an IT system which has integrated all these 6,000 plus collection points and labs in a manner that we are able to give online services to the people. Now that's something, again, which is replicable. Now, we have invested hordes and hordes of money in creating this. 17 years it has taken us to really polish this system. And now we are giving none of the money to those high-tech companies or the software companies by selling this product as a standalone product, which we call as CLIMS, Centralized Lab Information Management System. So my IT department has become a profit center to me. Logistics. I mean, imagine connecting 6,300 centers with those labs. Believe me, Herculean task. It's not easy. People undercut the prices in India. What is being sold in the US for $100, we are selling for, say, $10. There are people who are undercutting the prices by selling it at $8, $7. Now, the point is that whether are they able to maintain that quality? Just to give you an example, logistics doesn't essentially mean picking a sample from one place and transferring to the lab. It also means that you have to maintain the integrity of the sample. Incidentally, we are the largest consumer of dry ice in the country, and it comes very expensive. It is not Haagen-Dazs or it's not the walls of the world that that consume more dry ice than us. It is SRL. Not many people would know this. The kind of cardboard boxes and the packaging material that we use is super quality because we have to maintain the quality.
So if I understood it correctly, Sanjeev, what you're saying is, as a large operator in a large emerging market, you have built certain economies of scale. You believe that the market conditions in your market, India, is very similar to what you're seeing here. Obviously, there will be nuances one needs to understand, which is why you're partnering with someone like Dr. Benson. But at a high level, there are huge similarities. So this is an opportunity for you to bring in those economies of scale, all the processes, systems, people that you're in the back end, and deploy it to a larger global marketplace, not just on a commercial basis, but also because you feel you can make an impact and have an impact.
Correct. Yeah.
Thank you. Fareed, I was in India about, I think, a week or so ago and spent a good 10 days there. And one of the things that we saw there, and I went there specifically to look at some of the medical equipment companies, is a huge number of homegrown companies emerging. But one thing which I found was common across those companies, pretty much all their founders were former GE employees. They're people who had spent decades in GE. You also have the Jack Welch Center for Innovation in India as well. So it seems like in that market, both due to your R&D efforts through that center and also through the sheer talent, the talent that you have, which coincidentally the gentleman sitting to your left, Sanjeev, I don't know whether you know it, he is an alumni of the GE Leadership Institute as well. So it seems like a combination of what you might have in your active strategy, as well as the effects of your talent migrating out and setting up enterprises. Seems that sector in India owes a lot to you. So in similar veins, I know you're doing a lot of interesting things, a lot of things differently in the healthcare space in Africa. Can you specifically touch on those? What do you think could be potential shapers of the future healthcare industry in the continent?
Yeah. I think first I'll touch on the point that you made on entrepreneurship, because it's not unusual to see ex-GE being entrepreneurs, because at the end of the day, this is what's been driving the company for more than 100 years. Thomas Edison, to some extent, was an entrepreneur. So, and he did a lot in terms of developing infrastructure solutions for the world. But it's true. We're a technology company. We're a global company. So sometimes we might look at GE like that big machine that doesn't really look at the individuals or the initiatives, but it's actually the contrary. I don't know if you know, but we create much more jobs through the supply chain of GE in every country we are, through the development of the SMEs. And I think even Jeff Immelt recognizes in every forum that unless you create that ecosystem, you know, for GE to be a global company would be challenging. So I think this is what you keep in mind. So we're a technology company, and you put it, and I'm glad you mentioned India, because, you know, we committed in 2009 through a program called Health Imagination, about $6 billion of investment that we would do, just developing adapted technologies and cost-efficient technologies that will combine, you know, affordability, cost, and quality, which is something that GE, like I think people in this panel, in this room, do not compromise on. And to date, we've spent about $4.2 billion of this program, just developing technologies that we believe are meant to be serving specific purposes, particularly in emerging markets, and the likes of our portable ultrasound that I'm sure you've heard of, that enables us to really you know, address key and acute issues like maternal and infant mortality, whether it's in India, whether it's in Africa, whether it's in Indonesia, by just being able to take diagnostic to homes and villages. You know, the biggest problem when I took the job 3 years ago, and I've got a banking background, so for me to be converted into healthcare, the first thing I saw in Africa is that two things that struck me, and maybe some preconceived ideas. One was, you know, most of the patients do not come to hospitals. So it's good to have hospitals, it's good to have diagnostic clinic, but the reality is that most of your patients are in rural areas, in remote areas, that the level of trust in healthcare facilities is not that high among that population. So how do you know, reinstate the trust into that referral system so that people come to a primary level of healthcare and then flow until tertiary level? So that's the one thing that I noticed. The second thing that I noticed is this is a continent that has been, you know, plagued with communicable disease. I mean, Sanjeev mentioned that, and that's been the combat of whether it's the NGOs, whether it's the governments, HIV, malaria. But, you know, within a few decades, and that's tomorrow, you know, non-communicable diseases are going to claim much more lives than communicable diseases. So we've made progress on HIV, and I think we should applaud that. But where are we on non-communicable disease in Africa? So that's the two things that, you know, I said, you know, we need to do something about this. And we humbly recognize that we don't do things alone. We have great technology, and we're known sometimes to be on the high end of the technology, but we've proven that we can develop technologies that actually can be developed, designed specifically to address the issues I've mentioned, or issues as safe surgery in rural areas that we know in Africa is key, like developing ventilation systems in operating theater, you know, in the middle of the most remote areas in Africa. And we did that through partnership, you know. If just telling you and taking an example, when we developed, and Amit is around, I think, from the East Africa, and one of the things we did, you know, looking at, you know, reverse innovation, is really spending time with the people on the ground, those that we serve, because, you know, at the end of the, ultimately we serve the patient, but we work through radiologists, anesthesiologists, doctors, and these are the people that really use our technology every day. And we worked for 2 years with the Anesthesiology Society of Kenya to really understand what would make a good ventilation system for them to pursue what they have to do. And I can tell you in East Africa, a lot of doctors do surgery in war zones in South Sudan. And this is the people you're talking about. So when you start having that approach, and within 2 years we listened, and we designed a system which is the Care Station 30 that has everything that, from a functionality standpoint, is critical to do safe surgery, but has battery that has 6 hours of autonomy so that you can use when power goes off in these, or there is no power at all. And that's the kind of technology or the kind of mindset that we've shifted into. And we don't typically go today, while it was the case probably a few years back, where you would take a system from Europe and the US, strip it down, bring it to a cost that is acceptable, and then throw it in the field in Africa or India. It doesn't work this way. So that's the kind of mindset shift that you have. Now on the partnership, one thing that we realize as well, because sometimes, and that's the kind of initiative that we're talking about with the Eagle Eye, why is GE even bothering helping develop? At the end of the day, you want to sell your boxes and you want to go away. Well, this is exactly the kind of things that doesn't work in areas like Africa, because unless you really shape things and create the opportunities and do a lot of project development, and I think on this panel, each one of us is doing project development in Africa today, and bringing the pieces together where, at some point, it's the IFC that is going to play the catalyst role. Another point it's going to be GE, another time it's going to be SRL or Abrage. But this is exactly what we need to do, because otherwise, for the long term, we could be sitting here and commercially, because at the end of the day, GE, just like SRL, just like EcoScan, are commercial companies. We're a for-profit organization. We're not going to be selling technology if we don't do that. And that's something that really we keep in mind very strongly in areas like Africa. So naturally, when we met with EcoScan, and we said we're in Nigeria, 180 million people, and there is no, I would say high quality, doesn't mean state-of-the-art high-end, high-quality diagnostic centers that could do, wing-to-wing diagnostic imaging lab, and avoid, patients to travel to get the basic screening that they need, because that's the reality on the ground in many countries in Africa. I think the assessment of the cost of people flying out of Nigeria every year to get treatment or even diagnostic is about $1 billion. So that's quite huge. And in an effort to what can you do together, just combining our efforts to keep patients at home. And if we bring the quality of diagnostic and treatment, then you're going to also keep your doctors at home. And I think that's the goal that we want to achieve by doing what we're doing.
That's great, Farid. Thank you. Thank you for that. The summary that I took away is basically GE is certainly not looking at it as an equipment manufacturer. You're thinking of yourself as someone who can help shape the healthcare structure.
Absolutely.
And be a partner to entities such as, and individuals such as Dr. Benson. And I think that is an important message for a lot of the entrepreneurs.
But it's both. I think you can be, because we're an equipment manufacturer. This is what we do for a living. We're a technology company, and we invest into that. But if you want to make your business sustainable over time, in a context that is Africa, that's what you have to do. You might not have to do that in Europe or the US, but in Africa, that's what you have to do.
Great, thank you. Alex, you are just about starting off with this venture where you're looking to acquire stakes in hospitals in Africa. Very similar to what Dr. Benson said. There are entrepreneurs who need capital, but they also need operational expertise. Can you just give us a sense of how you're going to do that and just that whole enterprise?
Yeah. Absolutely.
In 2 minutes.
Yeah, sure. So really quickly, Biju, the thing is, I'll answer your question, But just to give you some reference to context, I think there are three reasons I'm sitting here. The first is actually Sanjeev. The second is to remind you all that Mauritius is part of Africa. and really the third thing is IFC, yeah, the third reason I'm here. Now, to put this all into the reference, with regards to this discussion, the first is that, Sanjeev was the head of the growth function at Fortis. When Fortis was looking at expansion internationally, we went to Mauritius. We met with CL, which is one of the larger Mauritian groups one of the largest Mauritian diversified industrial groups. And basically, both of them came together to pick up a controlling stake in one of the oldest and largest private hospital in Mauritius. Now, this facility is set up in 1953, rebuilt in 1997. Great facility, great brand recognition, but really, it was not doing well at all. It had fallen into a debt trap. It was losing money left, right, and center, and we realized that this was a great opportunity. So Fortis came in. I went as part of the team. So thank you, Sanjeev. I went as part of the team. We worked there for 3 years, and literally we're 6 years down the line now. The facility has gone up from being a $12 million facility to a $23 million facility. It's listed on the stock exchange of Mauritius at a market cap of about $33 million. And profitability has also gone up from almost 1% to 10%. Now, saying all these things, the only reason that facility has done well is because we, first off, after the partnership, we got in great operational expertise there, and we really upscaled the facility. Okay, moving on from there, I think that's when CL realized that healthcare is a great potential. It's actually a great business. Let's look at Africa. So through CL's private equity arm, they invested in a facility in Uganda, and this is when the partnership started growing, because CL and Fortis, CL said, okay, guys, you've helped us do it in Mauritius. Can you do it in Uganda? So we said, yeah, sure, let's give it a shot. So 18 months, we took on a contract for one of the largest private hospitals in Uganda. Ran it for 18 months. Let me tell you this, in a short span of 2 years, from losses of about 1.7 billion shillings, the following year, we actually reflected a profit of 1.4 billion shillings. So a 200-degree turnaround. Now, this could have not happened without that facility being there to begin with. So it is really the entrepreneur was there. The entrepreneurial skills are there in Africa. But what is lacking is, access to capital. One big thing though, but Shakir is here now, so it's all good.
That's taken care of.
But access to capital, access to getting good equipment, getting high-end equipment, access to real know-how of driving the business forward. And I think looking at all these things, I think this is what we're trying to bring together. And this is what we're trying to do. So CL actually, it's a very young company, but I would like to believe that we're a healthcare company which is focused on Africa. We're looking at creating a pan-African brand. Yes, we'll take it slow, but we're looking at building a pan-African brand. And we're looking to do it with the support of someone who knows how to run hospitals. Fortis, I started in 2002 with one hospital. I mean, you guys all know the story today, yeah? So I needn't go down there. But it's been a great partner. And it's just been these partnerships which have taken us to the next level. I mean, all of us are sitting here today. Africa is the next big thing, yeah? Let's be honest, Africa reminds me of India about 20 years ago. Pretty much the same situation, brain drain, no infrastructure, no facilities. Apollo was the first big giant to actually set up shop. And thereafter, so many players have followed. And today, it's doing great. So there's no reason why Africa shouldn't be at that level now. It's the same population. Yes, different countries in Africa have their different parameters. But the fact of the matter is, if we can work on partnerships which have worked in 2 countries in Africa, I don't see any reason why this can't work in more countries in Africa.
Great, thank you. Shakir, final word before we get on with the audience questions. Specifically, I know that obviously you do traditional private equity investments, and you've done that all your career, but over the last few years, having seen some of the very innovative things that you are trying to do. Could you just talk to us about that and what you specifically, as you are doing those innovative investments, how do you balance innovation with commercial returns? So give us an example and answer that question, then we'll move on to the audience.
Okay. But I think before I do that, I'm going to ask the audience to give themselves a round of applause. This is the core group out of 300 people who are actually interested in Africa right now. So please, thank you very much. It also has the benefit of forcing anyone who's typing an email while I'm talking to stop. Private equity guy, ulterior motive. Let me tell you a little story, actually, which I think will provide a little bit of context to the question you asked. A few months ago, I was traveling, and I pitched up in a European city, not to be named, and handily flashed my Kenyan passport, because as Biju said, I'm very proud to be Kenyan, and was directed towards some people with green coats and masks, right? Because of this fear of Ebola. And as I approached the person, I purposely coughed very loudly. There, you should have seen the pupils dilate behind the mask, right? And I was like, relax, it's not Ebola, it's HIV. Now, that's a story to illustrate a couple of things. Number one, the fact that there is the distance of China and the United States and India between Kenya and Liberia, something that's not very well known. People just don't understand right now what the healthcare issues are in Africa today. Number two, the real punchline to that particular joke should not have been HIV, it should have been emphysema. There's a shift in the disease burden that's happening in our markets. It's happening very rapidly. The existing healthcare infrastructure in a number of the markets in Africa are inadequate for what is happening. There are some very good facilities for people who have a fair amount of money to be able to be serviced in the way that they need to in these particular markets, or indeed buy the appropriate tickets to fly out to India and the like. Governments have tried to do their jobs with varying degrees of success on the public policy side. So, they've built out infrastructures that, are focused more on this communicable disease issue and on primary care. But what's been happening more recently is there has been a massive emergence in socioeconomically in terms of the middle class. I mean, to give you an example, by 2025, Nigeria alone will have 40 million people in the middle income, which is greater than the population of the entire United Kingdom, right? Being middle income. These guys have cash to spend. Once they have food and shelter, the two areas where they're next looking for is healthcare and education, right? The healthcare facilities to support them simply don't exist, because there are entrenched models for how healthcare should be provided. The fee-for-service model is a great example of that. Over-intrusive government regulation is another example of that. Now, within this environment, you've seen a few businesses, private businesses, actually set up and try and provide healthcare services to this middle income. And they do it with varying degrees of success. I've been investing in these businesses over the last 5-6 years or so, and I can tell you that it's done with varying degrees of success. To get to Biju's question around innovation, let me be very clear. The market is the middle income. The rich will always be able to take care of themselves, right? Universal health coverage is important, but I don't think it would be sufficient to cover the full suite of people, and there is going to be a degree or need of copay. I'm not overly focused on that particular market. What we need to do is create innovative models for the delivery of healthcare that drives down the price of this healthcare delivery. How do we do that? Well, we do it by making sure that we have scale, because there are basic economies of scale that will allow you to procure certain things at a lower price if you're buying them in volume, and you leverage your overhead costs. That makes a lot of sense. You do it through process innovation. Now, India is a great place for where process innovation has taken place. Dr. Devi Shetty was describing what he's done on cardiac care. Arvind is a great example when it comes to ophthalmology. There are certain smart things that you can do. And then the third area is the area around pushing down the ability to provide clinical delivery to people who are not necessarily always doctors in the first instance. In Kenya, we have a great program of clinical officers and medical officers who have a specific parameter of clinical services that they can provide. They can be trained up much easier. They also may not have entirely the same ambition of people coming out of medical school who are thinking, I set up my clinic and in 3 years I'll be driving a Mercedes, right? So you leverage this within an institutional framework and you break a fee-for-service model. You have doctors who are very concerned and care about what they're doing. Dr. Benson described the original ethos of where EcoScan came up, and Abraj takes full credit for calling it Project Eagle Eye, which Biju mentioned. We unfortunately didn't end up doing that particular transaction, but that enthusiasm is something that is very important to us. And you combine all of these elements into an infrastructure and you scale it. Now, do these businesses exist right now? No. In a number of the countries, they don't. Does the intention to create them exist? Yes. And now, the capital. And most importantly, we can't reinvent the wheel in Africa. So let's go to places where these models have been successful. India is a great example of that. And I'm very happy to say that listening to Dr. Devi Shetty when he was giving his keynote, he was saying a lot of stuff that resonates with the way we're thinking, but it also resonates because we are working very closely with him as a branch to bring him in to a specific facility that we're going to be setting up in East Africa, where we will be leveraging exactly those principles to ensure that we can deliver care and drive down the cost of providing complex cardiac surgery services from the price point that they sit at now in Nairobi to about half that for 50% of the patients and even lower for the remaining 50%. I can't go into too much detail. Bijal was trying to give you an example as you requested, but we're moving. So the vision is unlocked, the capital is unlocked. We need to build up elements of the talent, but we're doing that. And I think the next 5 to 7 years in Africa are going to be extremely interesting. I hope the next time we have this panel, we'll be able to talk about these successes and all these seats will be filled.
No, absolutely. I think, as I said, the last time it was opportunity, this time it is what are people coming together to do. Next time, hopefully, it'll be the results. But just before throwing to the audience for your questions and thoughts, in essence, what we are hearing here is very simple. The opportunity has been clearly recognized. The key success factors, scale, great processes and systems, the ability to bring in the right kind of partners in order to get as close to your consumer, to understand them as well as possible, as Fareed articulated. These are the key pieces. And there are entrepreneurs who are out there, whether it's an Alex or Dr. Benson, trying to crack that opportunity. There are partners more than willing to step in and provide some of those expertise. And then there is capital, whether it's an IFC or an Abraj or others. So it's a matter of bringing those pieces together. And this is an example of how it has happened. But questions, thoughts? There is a mic there, yeah.
Congratulations for a very interesting brainstorming and stories of success. But allow me to raise the issue of risks and risk management, because we've had really very bad stories. So we're a company, we're running ophthalmic services, and we started a hospital in Libya. And you can imagine what happened. So it's gone. We were negotiating starting a hospital in Juba, south of Sudan. And 1 week later, before even flying there, there was this civil unrest and civil war. So my question is, how can we take into consideration this risk management? What do you do, apart from analyzing the risk and so on? Is there a way where we can, as entrepreneurship and as assets, can we really have some sort of backup, or I don't know. I would like to hear what you...
That's a great point. And I think all of us can offer perspectives, but I think, and I'll offer mine last, but specifically wanted to ask that of Shakir as an investor. And Sanjeev, you, as I started off saying, things are pretty rosy back home. So why are you taking that risk, and how do you think of the risk management? And if anyone else has anything to add, Fareed as well, okay, great. So Sanjeev, you can start, Shakir and Fareed.
So I think there's no easy answer to this one. It's a rather complex question, and as we say, it's out of syllabus. But let me still tell you that country risk aside, I think in this industry, you should be in this industry only if you believe in this industry. The passion has to be far more stronger. The urge to do something for the people has to be far more stronger than just making a business case out of it. Business will follow for sure. Country is going to, I mean, just because I'm scared of meeting with an accident, I don't stop walking on the road or crossing the road. It might happen, may not happen, but I think we have to do the right things, go with the right intent. And well, people have been talking about taking certain risk covers, but these come at a price. We have a very astute, model which we kind of, we got to put in place regarding assessment of the country risk and so on and so forth. But I think the benefits are far too more. And benefits, not just the tangible ones, but the intangible ones. Bringing a smile on the face of the people. I think that's one of the biggest tangibles. And as we also see, I think the potential is huge. The world is changing. The world order is changing. The countries which were quite risky until some time back, I was told, some people used to talk to me, my friends in the US and Europe, India is a dangerous country. Well, that's a perspective. So, I mean, the point is, ask Dr. Benson, does he think Nigeria is dangerous? What are you talking? Are you crazy? So I don't know. I mean, really, there is no straight answer to this.
Knowing that this business comes from Egypt, so
no, I understand. So I'll tell you, and sometime back, NBE, National Bank of Egypt, through their capital arm, Al-Ahli Capital, they had invited me about 5 years back. They wanted us to run 10 hospitals for NBE through Al-Ahli Capital. I had landed there after 3-4 months. I think this unrest happened. And then I think before that I'd gone to Syria, or after that, so I started going to Egypt and Syria. I thought, next time whenever I go there, or to any country, so I'm a bad omen, I thought.
I think Prague, the Czech Republic needs to watch out. Fareed,
yeah, no, I think that the best remedy for that, risk management, and within GE, we're a global company. We're in more than 160 countries. And the best response, and I think we've learned that as we went global, is to be local. You localize. You understand the risk when you live a Nigerian life in Nigeria, when you have your people on the ground, because these are your people you trust, that you empower, that is going to give you the reality on the ground. And we have been investing a lot in Africa. We decided we've got more than 4,000 people throughout the continent, and we keep adding. And I can tell you 95% of our employees are from the respective countries. So they are local talents that we empower, that represent the GE company. And up there in Fairfield, or in Milwaukee or in London, when these employees, there are bumps. There are bumps in Libya. We have activities in Libya. There are bumps. There are bumps in Nigeria. Egypt, almost shut down for a while. We didn't disappear in Egypt. On the contrary, we invested even more with putting more people. Because these are cycles. And within Africa, you would have those cycles. So, localize. And localization is the key to understand better. And I think if we all localize, we're going to have different perspectives, and we're going to be the one investing even more. When we sell our equipment, and one of the things we learned in Africa is that we used to sell equipment but didn't have the right people and staff to take care of the service and maintenance in many places in Africa, which was a disaster. Today, if you ask me, I sell equipment but I don't have the people on the ground to take care of this, I will decline to sell equipment. I mean, this is crazy for a commercial company, but it's the right thing to do. And that's the kind of things we need to be doing. And if you do that, I mean, it may be easier for a GE to do that because we can deploy a lot of people very fast when we believe in a strategy. But I think when you have your eyes and ears on the ground, risk management is totally different.
Shakir, do you have anything to add at all?
Sure. There's intrinsic risk, and then there's ignorance. We've just had a successful shift of power in Nigeria. As someone who has investments in Nigeria, I was also a little concerned when this was happening. But we've just had a successful transition of power in Nigeria. That's phenomenal. We've had successful elections in a bunch of countries. Kenya is an example where we came to the precipice, looked down, saw how deep it was, and stepped way back. We've had a successful election in Kenya. The fact of the matter is that there is some inherent risk in all of these markets. They're growth markets, which means there's a bunch of things that you will face. Not all of it is geopolitical risk. When we decide where it is we want to invest, actually we don't look at countries so much as we look at cities, because that's how we see opportunities. But, we've made some investments in Ghana over the last few years, and you've seen what's happened in terms of currency depreciation. That's more relevant to me than specific geopolitical risk. If I think about geopolitical risk, and so we made a decision not to invest in Libya and not to invest in southern Sudan, and I'm going to make sure that we don't get Sanjeev coming to Nairobi anytime soon. And, but that's the easy one. The difficult one is understanding, look, what are the specific regulations that might impinge on your business? How do you make sure that the company that the individual that you're dealing with is the right kind of individual? Africa is a great place to come and lose money very quickly if you don't know what you're doing. A few years ago, I was at a conference, and it was quite interesting because we had the China session first, and then we had the Africa session after that. And in the China session, the room kind of looked like this, and in the Africa session, it was full, right? And everyone was very interested and excited. And I asked a question to the audience: how many of you guys have actually invested in Africa? And about half the guys put their hands up. I said, right, out of you guys, keep your hands up if you've never lost any money in Africa at all. So the hands all went down, except for one gentleman from the IFC. And I said, I'm going to start telling some stories, and it also went down. And the fact is that I've lost money in Africa as well. The biggest risk is the individuals that you're backing, because good people will honor their agreements and will turn businesses that are not doing so well into businesses that can do very well. Bad people will take good businesses and spoil them. That, to me, is the biggest risk I look
Thanks
for.
a lot. I think that's a great question. Thank you for asking that, because from IFC's perspective as well, when we partner with entities like a GE or an SRL who are looking to expand into these markets, or other clients, we offer services beyond just investments. We have the ability to provide our assessment for whatever it is worth of the macroeconomic situation. In addition to that, we have a sister organization which provides political risk insurance as well. So it is a very pertinent question, and I think Shakir hit the nail on the head. There are certain macro and geopolitical aspects which one can at least guard against, but there are several aspects which are the very nature of the market is such that you can't guard against those. So just take the risk. Looks like we have
very quick one.
3, 4 questions. 5. Okay. So Olumide, why don't you start?
Right. Just a quick story here. About 15 years ago, 2 large telco companies came to Nigeria. The bigger one saw risk, danger, and trouble in Nigeria. The smaller one said, well, it doesn't matter. I'll go for it. The one that took the risk is the largest telco company, one of the largest in the world, and the biggest in Africa today, because that company didn't see risk. Same thing will happen here. Watch this space. Last night, I met a gentleman. I'm not sure if he's in the room now, but we were just talking at dinner, and he said, look, the largest number of patients outside my country come from Nigeria. I said, so why are you not investing directly in Nigeria? I said, oh, it's too political. Nothing about regulations or the things I would expect him to say, but he said it was too political. I think that mindset needs to change, and the earlier people see the opportunity we're talking about here now, the better. My question to Shakir, it would be nice to share how the reaching the bottom of the pyramid in terms of investments in Africa through the African Health Fund. Has that worked? Is it something that you think will go to scale at some point? Because at the end of the day, people want to ask how this kind of investments will affect the lives of the poor and people at the bottom of the pyramid.
Thanks a lot, Olumide. Okay, Brian, Claire, the gentleman there, if you can quickly ask your questions as well.
Yeah. I'll be brief. Comment. It's fascinating to see that the business model going to Africa is largely coming from Indian experience. The question I have is, particularly to Shakir and Biju, the boxes checked are technology capital, human capital, business model capital, drugs, and biosimilars. There's one piece that is not functioning very well. That's on the medical equipment front. Indigenous, when I'm talking about, is non-Western based, with all due respect to GE. The question is, where are you investing in terms of medical equipment? And second is, how are you navigating with your political and policy clout to reduce import tariffs and ascertainment for sure that these equipment can be made available at an affordable price and serviced?
Thank you. Claire?
I'm Claire Omashe. I'm the MD of JNC International. I'm also the president of the Healthcare Federation of Nigeria. My question first is to Shakir. As you know, in developing countries, especially Nigeria, the recurrent decimal continues to be amongst entrepreneurs and amongst people that really want to do really out-of-box, disruptive projects. The fact that most of these new projects are greenfield. To your mind, what do you think, or what are the opportunities of private equity actually investing in greenfield? Because we've talked for the last 48 hours about disruptive thinking and about doing things in a different way. I'd like to understand what you could do, because it's something that's very pertinent. My second question is to the CEO of SRL. As you're aware, unfortunately, this is Africa, so we can talk about some home truths. There are several practices that are great for getting foreign direct investment into countries, and there are certain things that happen in country that are also anti-foreign direct investment. I think it's great that there's private-private partnership in front of us, with the collaborations that's going on. But I also think there's a huge responsibility for you to raise the bar in terms of ethics and in terms of standards. What is your opinion about paying commission to physicians on referrals? And, for example, and I'm just going to put you on the spot if you don't mind, there's been a lot of talk about us copying the Indian model. But I'm quite concerned, as the president of the Healthcare Federation, about the issue of paying commission, by many of the Indian institutions, big names, to Nigerian doctors, so much so that people in Nigeria are getting shortchanged. Sit in certain situations where they know it's terminal, it's not possible, because their commission's being paid, ethics and values are being thrown to the wind, and unfortunately this process of medical tourism is spurring it. And if you're coming to Nigeria, can we hold you responsible? I know Dr. Benson is way above board, and he knows what I'm talking about. But would you, as an organization, partner with us to make sure you can raise the bar and stop these unscrupulous practices, and let's actually snip it in the bud? Thank you.
So one final question from the gentleman there, and we'll come back to you so that everyone can answer that.
Thank you very much. I'm Hatem El-Gabali from Egypt. I just have a comment because I'm new to the investment in Africa and so on. Every time I attend a meeting, everyone who was intending or planning to invest in Africa always wears like a hat of sainthood. He's going there and he's going to help the people and he's going to support them and so on. But actually, all of you guys are going there to make money. That's your prime objective. So let's be always down to earth and say, okay, we are investing in Africa to make more money than we will make in China or make in other parts of the world. Because this sainthood thing is going to be exposed sooner or later. The second comment to the lady who has just spoken about commissions. I've been in the radiology business for over 40 years, and in Egypt, commission business is very strong. And probably everywhere in the world, even in the US. Yes. I know that because I have a lot of friends working there. We have developed a system in our business in Egypt that we don't pay a single penny to any doctor who refers anything to our clinics. And we are the only clinic in the country that does that. And the only way... The other thing I want to say, the only way you could do that is to achieve excellence in performance, where people fall in trouble with other places and then they refer to you, and then they know that you are different. And on the other side, also there is a social...
Sir, sorry to interrupt you, but got the point?
I want to make another point. There's a social transformation where the public becomes aware that there are connections between the doctors and the referring centers. So they always don't trust the doctors. Thank you very much.
Thank you. So, some very interesting questions there. Let's start with what I think is probably the most important, this whole question of ethics in healthcare. So I think I'll pass it on to Sanjeev to answer how you look at it, and particularly specifically with regards to your expansion into Africa. You spoke about values. What are those values?
So Claire, right? Claire, when I said at the beginning of my address that we could resonate with what is happening in Nigeria, Sub-Saharan Africa, is precisely what I was alluding to, one of the points. India is no different, let me just tell you. There are practices and there are practices. We come in the latter. We don't give any referrals to anybody. We don't generate cash in our business. We can't dole out cash in the business, from the business. Now, how it is done, let me just tell you how the brand is built. If a doctor has to send his own tests or the test samples of his kith and kin, they'll send it to SRL. Not only that, they'll try to reach out to the senior most person he knows in the company. Hey, this is Dr. X calling. This is my sample, or my son's sample. Okay, I want the results. But when it comes to sending the samples of his own clients or anybody or the patients, they couldn't care less whether it goes to X, Y, or Z. So the point I'm trying to make out here is that it's up to you. You want to create a brand which is to be known for the value system, known for the kind of work that you're doing. I think you have to really toil a lot. You have to work very hard on this. And I'll try to kind of, dovetail gentleman's question about sainthood. The company is about 20 years old, my company. Until about 3 years back, we were into net losses. I'm not taking pride in the fact that we were losing monies on this. Our EBITDA was sub 10%. But that was a conscious call not to cut corners anywhere. Well, if the money was the only consideration, believe me, Nigeria would have been where the US is. There would have been people who would have sensed that there's a lot of money to be made here, and let's just wear the, ignore the sainthood hat and go there. Sorry, I mean, I'm, being a little direct. But the point is that, look, I think, as I told you, healthcare is not the place only for money. If you have to make money and quick money, please go and join health, do the retail work or put the monies into the real estate. Perhaps you'll be able to make faster money there. I think here you have to be passionate about what you're doing. And we believe in what we're doing. So I think ethics is something which you have to gradually build. You have to say no to certain things. You have to draw a line. Now, one other thing which I want to highlight out here is why it will make sense for this kind of a collaboration is the fact that we have the local hand-holding. We know a person who has been there, done that. He knows how the business to be run there. We've got an international leader in the form of GE. I mean, they not only understand Nigeria, they understand Timbuktu and Asansol of the world. So we are fine. I think we are doing our bit. Yeah, sorry.
And known for governance.
Yeah, known for
All
governance.
I want to say is
and
that
IFC.
This association that bears the name of IFC and GE, we spent a lot on governance.
So IFC
we don't sign up without the governance.
Incidentally,
so I can assure you that this is, and during all the setup of this project, there was a long, long discussion on governance and on these topics. So this is clear. We know the reality on the ground in Nigeria, like in many other countries.
So I think Claire, 2 years, next conference, we should see how it is expanding out as well. But starting off, it seems like
it's not going to be easy. We understand that. I mean, it's not that it will be not all roses in the path. No, not that. But I think we'll try and do whatever we can.
But I think back on the point of we're making money. It's true. We're commercial companies. I said it. We sell technology. But at the end of the day, it's not only about making money. And you know Dr. Hatem better than me. You invest before you make money. And if you do greenfield, by the way, the basis of greenfield is that you're going to have development cost before you have return. So you need to do that. And that's what we meant. It's not about being sense of Africa. And honestly, it's about looking for the long term of how you can build sustainable models that can work and generate more money for entrepreneurs over time. Yeah. But at the beginning, you need to invest. And I think this is the path we took. And in doing that, we've challenged our own models. Because typically a GE or an IFC, and we're talking about the IFC of the past, in this example, IFC did things that they didn't used to do in the past. GE did things they didn't used to do in the past. But in Africa and now, that's the kind of things you have to do. So it's a conscious decision that you make. And I'm sure that I know this is what you're going to do as well in Africa.
Thanks a lot. I think just jumping on to the other questions.
No, just one point. Just one point on that. I think we should.
I thought they asked me the question.
I think the one point that I would like to make is the fact, and it'll answer a couple of questions actually, is that first off, we're all in the private sector. Yeah? We're not funded by governments. We're not funded. No. We don't.
It's our own money.
It's our own money. Yeah. So let's be very clear. We're all here to make money, but we're all here to do it in a good manner. The first question I heard on medical value travel. Yes, it's a fact. 30% of the medical value business that goes to Fortis Healthcare in India comes from Nigeria alone. That's a fact. Okay? But the fact is that at the end of the day, there are only so many people who can travel. Yeah? At the end of the day, there are only so many people who can travel. There is a mid-market which is there, which can only be catered to if you are investing in those countries. I think I need to make this very clear, and the only way that people will come to your institute if you have, if you actually have good outcomes and if you actually have built a good reputation. So
great
just
point,
want to
Alex.
answer
Thank
those
you.
2 points. Yeah.
I'll quickly try to answer with possibly Farid's support the questions around medical equipment before passing it to you, Shakir, for the questions on AHF that Olumide asked and the greenfield. So on medical equipment itself, Brian, unfortunately we haven't been able to do much particularly when it comes to manufacturing. And it's not for lack of trying. We did a fairly thorough analysis globally of the medical equipment market, and we looked at countries if we try to categorize countries based on through two parameters. One, the total healthcare expenditure in that country, and two, the absorptive capacity, a factor that we created by combining number of doctors in the country per 1,000 patients, number of hospital beds per 1,000 patients, logistics, etc. Essentially to understand, even if there were medical equipments available, can it be absorbed and used properly? So when we made that grid, unfortunately, almost all the African countries fell into the bottom left corner, where the total healthcare expenditure was low and the absorptive capacity was low. So if you think about creating local manufacturing, that's a very tough environment to do it in. But that said, it doesn't mean you just leave it and leave them without any intervention. So our focus, knowing that this is the paradigm in which they fall, is to improve the absorptive capacity, to increase healthcare infrastructure and so on, to put right policies in place which can enable the growth of the ecosystem, which can increase total healthcare expenditure. And Olumide, who asked the question slightly earlier, is leading that for that effort in Nigeria. Dr. Kama Rogo is here. He leads the Health in Africa initiative. So we are spending time helping build the ecosystem there. And in the meanwhile, from the medical equipment perspective, we are working closely with GE and others to see how we can facilitate leasing of these equipments by SMEs, how we can possibly look at training of technicians for medical equipment. So basically, while in India or a Brazil or a China, our investment thesis with regards to medical equipments would be about investing in manufacturers, investing in innovations, because the total healthcare expenditure absorptive capacity is fairly high there. In these markets, it's more about helping create that environment, and then hopefully over the next 2 to 5 years, seeing some manufacturers into whom we can invest. But yeah. You might have...
No, but Bijou, I think this is a fair question, because when we look at the reality is that not only none of the medical equipment manufacturers today or very little in Africa. Same thing for production of drugs or vaccines. So these are two gaps that need to be filled. Now, it's a gradual process. That's why I was insisting so much on localization, because for a company like GE, and there are others in different sectors, to get comfortable, you need to be really a local player, to understand the regulation, to understand how the system works, to understand how your global supply chain, because when you manufacture in one place, you need to think that you don't just manufacture for a market of 40 million people. You may do for a market of 180 million people. But that's the economics must work, because to Dr. Hattam's point, we're a commercial company. We're not going to end up with plants that are empty or not producing for people to buy the equipment. So that's the kind of things. But gradually, we're moving. You start by doing your warehousing in Africa. You start by doing your multimodal repair shops in Africa. And we've announced an investment of $300 million in Calabar just to do that. It's oil and gas, it's power. We're doing manufacturing in Algeria for big turbines for the first time in Africa. Huge investment in billions, in hundreds of millions of dollars of investment, and creating jobs. Don't forget, behind that, you've got jobs as well. So it becomes a national discussion. So I think that's how do I think that we're going to get there in Africa? Yes. We did that in China. We did that in India. We did that in Latin America. It's going to come to Africa. It's only a question of time, but it's going to come.
Thanks, Farid. Shakir, quickly, before we need to close as well. So, and okay. 2 more questions to go.
I'm just trying to remember the questions.
Okay.
On the base of the pyramid, the investments that we have made, we were required to actually measure to see how well we were reaching the base of the pyramid. And actually, our investors in this particular fund, including the IFC and the Gates Foundation, made sure that our incentives were very much aligned on how well we were hitting this particular target. Out of all the investments that we've made, actually all of them are reaching the base target, which is 50% of the customers of the products and services offered by the businesses that we invest in are from the base of the pyramid. And over 40% are actually hitting the even higher target, which is 30% being from the bottom of the base of the pyramid, depending on how you define it. Now, the point is, we've made investments in businesses that are for profit and generating a profit so that they're able to attract the right quality of staff and medical talent and provide services to a population who otherwise would not have had access to these services. And, you know, Julius Caesar's money ran out, Bill Gates' money will run out. Charity ultimately is not fully sustainable, but for-profit ideology, business principles actually are sustainable because you can create organizations that will endure. And when you do that, you wean off a nation or a continent from securing or requiring charity to take care of its own people. Frankly speaking, with what we've done and what we're intending to do, I am certainly hoping within the next 10 years to be called Saint Shakir of the Church of Abraj, because we're actually doing what it says on the box. You know, and I am very, very personally and ethically proud of this specific model that we're taking, because that's exactly what it is that we're targeting. Now, to the question around innovation and greenfield. As I mentioned earlier, there is a lack of the type of businesses maybe that have all the features that we feel that they need to have to be able to tick all the boxes and achieve exactly this objective. I'm not sure that I understand the whole greenfield, brownfield element, because even if we start off with a small asset and call it whatever it is you want, a catalytic asset and the like, with the amount of work that needs to be done and the fact that there needs to be a robust expansion into places where businesses simply were not there before, fundamentally it is taking that level and sort of risk, particularly if you want to do things at scale. So on that front, that's exactly what it is that we're doing. Now, there are other fantastic concepts that have come up in this conference. I have heard people talk about the Uberization of healthcare, for example. I don't really know what that means. Does it mean teaching taxi drivers how to deliver pregnant women? It's not that clear to me. There are certain new models that can be implemented, but the fact of the matter is in Africa today, we simply lack the ecosystems and infrastructures, and these need to be built. And anytime you deploy capital in terms of putting that out, you're taking effectively what is greenfield risk. And it may very well be 80 to 90% of the business that you're investing in instead of 100%. But even if you take, for example, EchoScan, the funding that went into that particular business was not around what the business was currently doing, but the grand vision that it was going to. And so if any small element of that fails, it actually takes an existing surviving business down with it. So you're not really getting some great degree of security from a large established business that's out there in the first place, at least not in Africa. So to me, all the risk is effectively that risk.
Great, thanks a lot. That's very well put. We are almost done, but I think since you've been standing there, we should get the question. So, gentleman here, Vikram, and then Felix.
I'll be quick. My name is Victor from South Africa. Africa is open for direct foreign direct investments. India is very leading in that sense. But I think it's also important to promote intra-African partnerships. I think I just want to find out from the IFC in particular what's been done to promote intra-country, intra-regional, intra-African partnerships. Because sometimes we probably think the answers lie outside Africa, but maybe Africa has the capacity to address some of these answers. What are we doing, and what is IFC doing to promote those partnerships? we probably as Africans maybe can move forward faster if we're working together and have the if IFC could play a role to help us to get to that point. Thank you.
Hi, my name is Vikram. I run a company called NephroPlus, which is India's largest dialysis network. And it's a for-profit business funded by IFC and Bessemer Venture Partners. My question is, being an Indian business, there is humongous opportunity in India, but the opportunity to make an impact, sustainable impact, because we all talked about how charity is not scalable. Now, what is the kind of structuring that Shakir and Sanjeev, maybe if you can take this question, what is the structure that's helpful for an international organization to do the business optimally? At the same time, we haven't addressed the repatriation of capital question, which is very important for international businesses. So if you can touch upon this, great.
Shakir, all yours. Because,
Last question, so I'll keep this simple. So it's great to see many of my friends here on the panel, and also to see where the conversation has moved from having traditional private equity as investors within healthcare businesses to more strategic partners and tying up more local relationships that then really allow you a chance to scale up. Fundamentally, though, the research shows that most of the investment opportunity is sub 100,000. And secondly, what we truly lack, and Biju and you and I have had conversations on this, is the ladder, the private equity ladder that goes from an angel network to traditional venture capital, to strategics, to now the arbitrages and the private equities and the IFCs. Do you see a time when, much like you have localized operations, much like you have set up these strategic partnerships, that will also start to localize the capital and build this ladder that I think is a key for the health sector?
Sure. Great. Thanks, Felix. So if you like, I can kick off with the specific questions addressed to
The first question,
IFC.
actually, Biju, I think it would be best addressed to Amit, because Amit is actually, he's the CEO of the Kenya Healthcare Federation, and he's actually put together all the private players. So I think, if South Africa wants to do something like that, I think they should definitely speak to this gentleman.
I was about to say that, Alex, you stole my thunder, but Dr. Kama Rogo, I would love for you to speak a little bit about this, Dr. Rogo. So we have, Trevor, an initiative called Health in Africa Initiative. We do many things as part of that. One of which is really helping enabling the creation of local associations across multiple markets related to healthcare, and getting them together under one platform and catalyzing some of these intra-Africa transfers that you suggested we should be working on. I'll let Dr. Rogo describe that in some detail, but before getting into that, from the investment side as well, we are working with several South African entities. For example, we are talking to entities from North Africa as well as we speak. So it is, while this panel right now, we wanted to highlight what has already been done and is in motion. So it happens to be the GE, Nigeria, India story here. But it's much bigger than that. There are many enterprises from other parts of Africa moving across boundaries as well. But specifically, Dr. Rowe, could you speak about the private healthcare alliances that you're helping build and how they are interacting with each other?
Thank you. Thank you very much, Biju. I was hoping I wouldn't say anything because everybody is so eloquent. And we now need saints, and I'm not one of them.
No, he is. Actually, he is.
I think that there's several things here that have been said that are important. Number one, people talking about the ecosystem in Africa, whether it is the wars and instabilities that we are talking about and so on. A quick reminder on geography, that Africa is a continent. So if something is happening in Juba, it is not happening in Accra. And if we took that to other parts of the world, you'll see how unfair it is usually the way people look at Africa. That if something happened in one area, then that's it. It's because international news is only bad news that's made of Africa, never good news. So there's so many parts of Africa where you can do good things, even if something happens elsewhere. Secondly, a lot of our countries where we've been working and where we are not working, there are laws that are coming in that protect investment. And I think that that one is important for people to recognize. That even in South Sudan right now, as we are talking, the people who have invested in South Sudan, their property has not been confiscated by anybody. And in the health sector in particular, countries that are post-conflict are the ones that need you most. In fact, the market is so lucrative in post-conflict countries in Africa that that is where the biggest profit is made. So high risk, but high returns that are in. So this is one thing that we would like to talk to everybody about. For us to be able to understand this, the intra-African collaboration is going to be important. And one thing that has been said here is the localization, being able to work with people who are on the ground. Because one of the biggest problems when you get everybody from outside is that the moment a gunshot is heard, all the expatriates are gone.
Exactly.
But the locals don't go. So when the expatriate is the only one who's working in that factory or in that hospital, the hospital has to close. But when you have management that is local, then for their safety, because their government is flying them out, they can fly out, but you still have a group there that's keeping you going. So I think that is a very, very strong case here to be made for that. Most important is that the human resource in Africa is huge. It really, really, really disappoints me when every statement made of Africa is capacity, lack of capacity. It's huge, but it's not been identified or utilized or given the opportunity to excel in areas where they can excel. So when you come to Africa, you're really not coming into a desert where there is absolutely no capacity. It is there. All the way from Egypt to Cape Town, it is there. And finally, in Health in Africa initiative, one thing that we've done is to try and get the private sector in health to work together, first at the country level, where we now have alliances like Claire was talking about Nigeria, to federations. We've gone further into creating larger markets. The biggest problem is that although we are one continent, there is 50-something countries, some of them too small to be a market for you. So how do you move that forward? In East Africa, for example, we are removing the barriers between those 5 countries so that you're going to be dealing with 160 million people as one market. You come and register a drug, that's it. You open a hospital, it can serve everybody from everywhere else. The same thing that we're working on in the ECOWAS area in West Africa and the big area of Central Africa where the 2 Congos are, Chad, Cameroon, and everywhere else. The same thing with the SADC group in the south. So we have 4 major market areas that you must start looking at. Stop looking at individual countries. Look at the market area. So if you come into Rwanda, it's not just Rwanda. You're coming into East Africa. And that is what we would like to see you do. And finally, which is important, is that there is a voice that is coming out of Africa that's asking all of you people who don't come from Africa that come and work with us. Help us grow together with you. Because there can be a 2-way traffic here on things that can move. I'll give you an example. If you look at the M-Pesa movement, the electronic transfer of money, the leading doers in this area is the Safaricom people in Kenya, globally. So we know how to move money. Somebody was talking about how money moves better than anybody else in the world. We know how that one can work. So how do we get that learning to be done in India? We can help the Indians with that on how to move money in this particular area, to be done in other parts of the world and be able to move forward. So we are open to people who want to invest in Africa, who want advice on the regulatory regimes in the different countries. But most important, should you be investing or wanting to invest in any country in Africa and you find that there are some regulations and laws that are inhibiting you, please come to us, because that is what we are paid to do. You will not pay us anything, but we'll work with the government in that country and help identify how you can go about that. But in terms of securities and everything, I do not think that right now, looking at Africa, we can talk of insecurities that are beyond what's happening everywhere else. Who knew what would happen in Ukraine? When it happens in Ukraine, why don't we say the whole of Eastern Africa or the whole of Europe is insecure? So these are the things that we ought to move away from, that language of the past. And that one you can only do if you stop relying on breaking news in CNN. And come down to Africa and break dance with us there.
Thanks. Thank you, Prof. Did we leave any questions unanswered? Any specific one? Because we are 15 minutes over.
Shakir, your questions.
I think Vikram had asked.
Yes, Vikram's specific question, and let's just do that and close it.
How do you expect me to follow after Kamarogo on that?
I want you to follow after him so that I can close.
Oh, right. Then you're in real trouble. Yeah, so very quickly, the question around, given what exists in one market, how is it that we come into the other? The fact of the matter is the only way any deals can be done with multiple institutions is if alignment is there. The alignment is not just economic, but is also emotional and strategic. So yes, it's very easy to continue growing to become the biggest provider of nephrology services in India. And there are a lot of tier 2 and tier 3 cities that you're not in that you could go in. But as has been said before, there is an emotional reason to come into a market where people who currently are paying $105 or $107 for one session of dialysis, and they have to have 3 a week in order to actually be healthy, and can't afford that, so they have 1 or 1.5 and end up dying much sooner, can benefit from a company like yours that can find ways of driving down that price to $80, $60, $40. That's immense impact. Number 2, it's a market that is growing very fast. I mentioned some of the opportunities around this middle income. If you're in now, you'll be first. It'll be yours. All the guys in India who are all very smart and see how successful you've been and say, you know what, I'm going to do exactly the same thing, will be left behind. You'll be protecting a very strong element of your future business growth. So you need to take that strategic decision. As to the third thing, economic alignment, that's a private negotiation. I'm not going to discuss it here. I think that
Thanks, Shakir. I don't know whether Felix is still around. His question was around how can we enable, catalyze, below private equity, even VC funding in Africa. And I think, Felix, part of that is it is a process. And as I was mentioning in reference to Brian's question, it's about helping build an ecosystem. As Dr. Rogo pointed out, we are doing that. Over the last, if you flash back to 2009, 2010, it was not too long ago, there were no private equity funds focused on healthcare in Africa. And then now you have Africa Health Fund, you have Investment Fund for Health in Africa, and many other non-healthcare focused private equity funds, whether it's a Catalyst or Fanisi or Helios, Satya, they have all invested in healthcare. Based on our data, about $120 odd million have been invested just by Africa Health Fund and IFHA in about 30 companies. And the others together have put in another $70 to $100 million. So I think it is, we certainly want to catalyze that space as well. But a lot of it will happen as a result of positive externalities being generated by the work which is being done by the Health in Africa initiative and some of the investments being done by investors such as Abraj, and such the ecosystem plays being provided by folks like GE and the IFC. So it is going to happen. We don't have a specific project aimed at catalyzing VC funding yet, but there are elements of it that we are all working on together. And it's also a good segue into just the closure. As I said, just these two institutions over the last few years. Since the time we've had this conversation, have deployed $150 million, 30-odd companies. As we look into the future, and just looking at Dr. Benson, his enterprise would have received about $100-odd million to set up centers across Nigeria, growing close to fourfold. We would have seen CL Healthcare deploy about $50 million over the next couple of years in hospitals across sub-Saharan Africa. We would have seen, hopefully by then, to Trevor's points, also real examples of South African entities, whether it's a Life or a LenMed or a Netcare or several others expanding into Africa. And there are those conversations happening, and possibly from North Africa as well, with respected entities like Saham already expressing interest in the market. So this panel for us was about looking back into the past, seeing that this opportunity that we were trying to peddle in many ways for the last several years, whether there are active takers to it. And it does look like over the last few years that has happened. There are a lot of entities who are coming together, bringing their own unique expertise and their local understanding to the market and trying to build something exciting. Now, whether they'll succeed or not, we'll see over the next 2 years. And power to you all who are doing that, and I'm really, really excited by the work. So firstly, thanks to each and every one of you for being part of the panel and for all that you do, whether for sainthood reasons or otherwise. And to this very, very exciting audience for asking the right questions, being engaged, and being here. And it's all about the future. Let's hope to possibly come back together again and look back and see what these entities have achieved, these individuals have achieved. Thanks again.